Thank you, Joy, for those kind words. And good evening to all of you. Thank you for inviting me for this symposium. It's always a delight to be back in CMC. I did my orthopedic training here, and for many years now I have been coming for the council meetings. It is my privilege actually to be a member of various organizations in the country which have a national impact. Most of these organizations were started when I was in the Bangalore Baptist Hospital, an affiliate of CMC, and I spent 35 years of my life there. Collectively, we have been fortunate that we have been able to influence the government and policy makers for some far-reaching, impactful decisions that they've made, and I'll just read out mention a few. The first one, it's not here, sorry. The first one was sometime in 2010-2011, the government had imposed a 5% tax on hospitals. So we had met the finance minister at that time, and actually this was passed, but it was rolled back. It was a long time ago. Subsequently, we were also able to make an impact in postgraduate medical education. As I said, we work closely with the National Board of Exams. You may not believe it today, but communication was not in the curriculum till 2019. So this was the result of a book that we had written, Communicate, Care, Cure, the first healthcare communication book in the country. Similarly, we have now written another book on health and climate change. I don't write the books, I get people to do it. So it's actually quite easy with the right people. So this health and climate change book is also, it's now been recommended by the Ministry of Health and Family Welfare to be introduced into the medical and allied health subjects, both in the undergraduate and in the postgraduate levels. I think quality is something that we're all very mindful of, and 80 to 90% of the care in the country is given at the Tier 2 or Tier 3 cities. And we actually lobbied with NABH and with the IRDA, and the IRDA has now recommended that 33,000 hospitals, and I'm paneled with them, will have to have at least entry-level certification. So this will benefit a lot of patients, poorer patients who go there. There'll be some guarantee of safety and quality. Increasing seats. Over the last 5 years, the government has increased the undergraduate, this specific to MBBS and postgraduate. The government has increased the seats almost double the number. We are aiming to request the government to make UG and government and the PG seats equivalent so that they will not be a waste of resources. CGHS rates, those of you who are not in administration, just a brief. The CGHS, Central Government Health Scheme rates, are the rates which actually indicate what the government pays to the private hospitals for reimbursement of services. A scientific study done in Karnataka in 2017 shows that this is 30 to 40% less than the actual price. The prices haven't been revised, and we have been assured that by the end of this month, this seven-year engagement with the government will bear fruit, and this is very crucial. We can talk about artificial intelligence data, but unless the private health players who provide 70% of the service are sustainable, we will not be able to move forward. And I hope that we will be able to make this happen. A few months ago, you may have heard that the National Board of Examinations, there was a proposal by the government to merge it with the National Medical Council. And for those of us here would know that this would have been a disastrous step. Fortunately, this has now been put on hold. Through the IRDA, we are also looking at health insurance for senior citizens. I think all of us know that those senior citizens like me, it's very difficult and very expensive to get insurance. Also want to inform you that we are in talks with the National Medical Commission to try and see that technology digital health technology is also included into the curriculum, but we'll have to wait and see. Now, this statement by Bill Gates is very, very true, and I'll just, from my own experience. So as I was preparing to come here today for this, preparing for this conclave, my thoughts went back to my student days in CMC. My first posting was in hand surgery, a very busy specialty. It was in summer, and how things have changed since then. I was on daily call, and for those of you who are familiar with CMC, I was staying in the hospital annex, that's in the main hospital, on the 4th floor. Those days, CMC was considered to be technologically advanced. We had the pager system, one of the few hospitals to have the pager system, and I don't know whether some of you remember the Bradma equipment that we had. So whenever I received a page in the middle of the night, I had to climb down 8 flights of stairs. There was no lift at that time in the hospital annex. Make my way to the only phone on the ground floor, call the exchange, find out who had called me, and then call that concerned person. If there was a case in casualty, I had to rush to examine the case, see him, stabilize him or her, write up for investigations or x-rays. Collecting the investigations was another story. Many times it meant going to the lab personally because the phones were engaged. And for x-rays, being an ortho, I almost always had to go to the x-ray department to collect the wet films. Admissions was a separate project by itself. I'm sure it's very different now. We had to coordinate with the nurse, find out whether the beds were full. We had to check with other units, borrow beds. If the patient required emergency surgery, multiple streams of coordination. The anesthetist, the blood bank, the theater. Again, a very laborious process, but this has taught me, I'm sure it taught all the registrars, a lot of patience and a lot of negotiating skills. OPD and theater usually started very early and finished quite late. Those days, detailed rounds with the consultant happened only around 6 p.m., 7 p.m. After rounds, we had to sit and do the procedures. And sometimes patients had to be kept awake way past midnight. In the middle of this, we had to prepare for a journal club or a seminar, and this meant spending hours in Dodd library sifting through numerous publications. We usually went back to our rooms in the wee hours of the morning for a few hours of sleep, if any, before getting back to the grind at 7 a.m. So we had very little time to ourselves, very little sleep, etc. Coming to the present. I think 3 or 4 decades later, technology has transformed India's health sector, and I think my generation has been there to see it, benefiting it in many ways. I'm not going to go through all these subjects because there are experts here who are far more knowledgeable than me. And though this is focused on AI and data, I thought I'd just mention this. This has been a learning, just to tell you, this has been a learning experience for me too. And I've learned a lot of things, clarity has happened. Today what I would like to focus on in this address is how can we further harness technology to aid the provision of affordable and accessible quality healthcare to all our citizens in the country. So the advent of technology has vastly improved the segment of patient care and patient convenience, not to mention that of the healthcare provider. In my estimate, if I had to do my residency again in CMC, I probably would save 2 to 3 hours every day. And this would help me give me more time to spend with patients, time to update my medical knowledge, and time to rest, which is, I think, very important when you make decisions with a clear mind. Just think about it today. At the click of a button, you have your lab investigations with you, you have your x-rays, you have all your updates, you can keep up with the latest in research. Crowded waiting rooms, in many hospitals, crowded waiting rooms have given way to AI-managed queue systems. Continuous monitoring devices enable nurses to keep tabs on vital parameters from afar. Surgeons now in many places use robotic arms to perform surgeries with a powerful combination of technical precision and human skill. Medical students no longer rely on mere books and diagrams to learn anatomy, but can interact with dynamic models to clearly visualize every organ, every muscle, every vein, every artery. Personalized medicine is becoming a reality. There is no doubt that technology has already obliterated many barriers and has unlimited potential to revolutionize healthcare in the country, and we must leverage this. Coming to the future, the environment is ripe for us to move on to the next stage. vision for India's digital health and healthcare system should include the widespread adoption of digital technology to develop better care to patients, reduce healthcare costs, improve efficiency, and provide more equitable access to care. Some examples which are already in use and which we can focus more on is infant and maternal mortality. With digital health, we can use it to reduce remarkably MMR and IMR by monitoring the health of the pregnant woman and baby, educating the woman on the importance of prenatal care and providing them with easy access to healthcare providers. NCDs, which is going to be a very large burden in the future, through access to information, resources, and tools, patients can better understand their conditions and identify their symptoms and factors. Telemedicine services, remote patient monitoring, and artificial intelligence algorithms can detect early warning signs, helping reduce the risks associated with NCDs. Machine learning-based models can predict individual risks of developing an NCD. For chronic diseases, using wearable sensors, telemedicine, virtual reality, all of this can be used to support people with chronic disease, helping them to better manage their disease, and will also bring down the rates of admissions. And we're hoping that with all these technologies, the number of hospitals the beds that are could be freed up for more critical cases. Preventive health and wellness can be used to promote wellness and disease in a variety of ways. For example, it can be used to monitor health data such as exercise levels, heart, BP, and other vital signs. How many of you monitor your daily steps? Just put up your hands, I'll have an indication. Yeah, so I think this is one of the examples of that, and this gives us an insight and also motivates us for better health. So also there are similar apps for food and sleep, etc. Digital health apps in wearable forms can motivate people to lead healthier lifestyles, monitor health indicators, and provide personalized health advice and support. Now, when you're looking at applications of digital health, I think it's important that our country should focus on developing a health system that is able to leverage the power of technology to improve the quality of care, improve patient outcomes. I think this is important. Create more personalized treatments, provide healthcare access to remote and undeserved areas. Digital health and healthcare systems, I think the ultimate aim is to protect the patient safety and security. The ideal digital health system should be comprehensive, accessible, efficient, effective, and technologically advanced, and importantly should result in empowerment of patients. I think at the cost of repetition, I think whatever we do should be the patient should be central, and we need to keep that in mind. We also need to use this to come up with newer and more efficient models of care. Already this is happening. I think looking at the big picture, a focus on preventive health and wellness would bring down the cost of curative care enormously. And this is one area that I think the healthcare providers and researchers should lay special focus on. Some of the other areas are in vaccination, health screening, prevention of medicalization, managing epidemics. Also need to remember that with the increasing population of older adults, the demand for preventive health technology is going to rise even more. I had some figures with me. I won't put it up, but the amount spent for preventive health technology today is going to skyrocket to 5 to 10 times in the next 3-4 years. Coming to the potential risks and challenges, I think several challenges, which many have already spoken about it, present themselves in this quest to harness technology for healthcare. All efforts should be made, especially to ensure access to technology, especially for the lower socioeconomic groups and for the rural areas. If technology fails or is misused, it can lead to serious medical error or even death. Over-reliance on technology, I think one of the speakers in the morning spoke about this term called dehumanization, and also leads to loss of trust. And this can lead to lack of empathy and compassion. Empathy and compassion, which are so crucial to us in the healing ministry. interoperability and adequate infrastructure also are key to making technology available easily. Many of the speakers spoke about cybersecurity and loss of privacy. I think this needs to be looked at, and preventive steps as far as possible need to be taken. I think the other point which was spoken about in the morning was the digital divide between those who have access to technology and those who do not have. This is a very real issue, and we have to go all out to ensure that we try and spread the message to all in our country. I think a major challenge which we really may not have realized and may not know, but some of the earlier speakers referred to it, is the lack of awareness on the uses of digital health technology among healthcare workers, amongst ourselves. I was trying to do some research on it, and what I got, I don't think it's true. This may be a year or two old. It says that only 4% of the health workforce is aware of advantages and the scope of health technology. It's probably a little more. And as was mentioned earlier, many healthcare workers also feel threatened that the advent of new technologies can replace the jobs and livelihoods. So we have actually written a book on the future of healthcare technology, which covers the basics, covers almost all we've been talking about and some other areas. This book has some very eminent authors. We have Kiran Mazumdar, we have Ajit Isaac of Quest, we have Chris Gopalakrishnan of Infosys, we have faculty from the Indian Institute of Science, ISRO, NHA, National Health Authority, and from INSTEM and from the Indian Institute of Management. And our previous CEO, Mr. Sharma, had actually endorsed it in a testimonial. This also has a chapter on careers for in this field. Also, this is not a marketing call. This book is available as a free download. It's also available for sale at a special rate for all of you, but it is available as a free download. Most of you are tech savvy. Please download it and go through it. We also, we have actually did some research, and we felt, I'm from one of the organizations I work is the Association of Healthcare Providers. And in our network, we have 20,000 hospitals, and many of them are small hospitals. So we knew this was a challenge, and we have been trying to address it. Apart from the book, we have actually started a course a certificate course in healthcare technology, purely it's done remotely. And again, the partners here were ISRO, Indian Institute of Science, and the Public Health Foundation of India. Now, continuing with the challenges, already there have been a plethora of cases. Most of these cases are in relation to data security, data privacy, and remote monitoring. But I just put this slide up so that we all need to be aware that this is also a growing area, and we need to be careful. We have actually brought out a book on health law and ethics. We'll ask Anisha to contribute to the next edition. It relates to cybersecurity laws and guidelines for health workers. Now, coming to the role of the government, I actually was going to talk to you about 5 to 10 minutes about the ABDM, but I think one of our earlier speakers did this beautifully, so I'm not going to go through it in detail. I'll just briefly allude to it. Much before COVID, the government of India was already using several digital healthcare solutions. I'm sure all of you are aware of it. One was the Auxiliary Nurse Midwives online app, which was done to improve healthcare services to millions of pregnant women, mothers, and newborns in the country. And the other was the EVEN, the Electronic Vaccine Intelligence Network, again introduced by the Ministry of Health and Family Welfare. The ABDM was announced in 2020, as was mentioned earlier, and the vision is to create a national digital health ecosystem that supports universal health coverage in an efficient system and in a safe manner, and provides a wide range of data, information, infrastructure, duly leveraging open, interoperable standard-based digital system, and ensuring the security, confidentiality, and privacy of health-related personal information. I won't go into details on that. But I want to bring one point to the notice of this audience and the policymakers who are sitting here. I have no doubt in my mind that the ABDM is going to transform the healthcare situation in our country. We are going to be one of the best managed systems in the world. But for this ambitious and transformational project to be effective, the government and the private healthcare providers need to join hands. As I mentioned earlier, 70% of the healthcare delivery in the country is done by the private healthcare providers. The big brother attitude of the government, I apologize to my government colleagues here, but I'm stating facts and I think we need to understand this. Though the private healthcare providers provide 70% of the care, there's not much involvement. Recently it has started, but I think if we are going to be serious about implementing ABDM, and if you want it to succeed, then I think it is necessary for a public-private partnership in the true sense. That we need to trust each other, we need to work together. Also want to mention that AHPI is an official partner of the National Health Authority to facilitate awareness and implementation of this path-breaking initiative of this government, and I really hope it works, because if it works, and there's not really much reason that it won't, it is going to transform the entire scenario. I think we spoke about regulatory framework, and I think it's a good opportunity to actually now influence the policymakers to ensure that there is ethical use, that patients' rights are protected, that there is risk mitigation between, so that the problems like inaccurate diagnosis, inappropriate treatments are avoided, and that we regularly monitor and evaluate the use of technology in patient care, and also ensure, again, at the cost of repetition, that digital health technology is interoperable, secure, and reliable. As was mentioned in the morning, India has endorsed the use of international standards and vocabularies such as FHIR, ICD, SNOMED, etc. I think it's important that all of us work together. Technology companies, healthcare providers, policy makers, and patients. I think it's important that patient is always kept in mind, and we use it to improve patient care. Now, this is just a brief slide on the resources, etc. As somebody was saying in the morning, you need money, you need resources. And the government, private, public-private partnership, healthcare providers, and most recently, venture capitalists have gotten to the act, and I think we should work together and provide the resources so that ultimately we are able to improve patient care in our country. The last slide, and I think this is probably the takeaway message that I'd like to give to you. I'd like to end this talk by emphasizing the importance of the human touch. We must ensure that healthcare providers use technology in a way that complements their existing skills and care. Technology can be used to support existing practices by providing more efficient ways of managing patient records and data, streamlining communication between care providers and patients, and providing access to useful health information or technology for supplementation. I think we need to keep focusing on the word supplementation. And use telehealth services, artificial intelligence, and machine learning to assist in diagnosis. Keyword is assist in diagnosis and treatment. Healthcare workers need to remember that technology should be leveraged to enhance our own potential, not replace us completely. That intangible feeling which goes by different names, the human touch, the bedside manner, soft skills, or simply effective communication is an essential component of a competent health worker's skill set, greatly affecting patient outcomes. Communication is the cornerstone of a strong patient-provider relationship. And again, while technology can never ever replace it, it can be used for its enhancement and improvement. Patients, this was again repeated many times, patients need to feel heard. They need to feel heard, they need to be understood, they need to be respected, and they need to be empowered. Going digital cannot come at the cost of this replacement. And I'll end with this slide. I think it puts everything in a sentence. This is by Dr. Berthelin Mesko, a medical futurist. The technologies that will have the biggest impact are those that allow the patient to become the point of care. Thank you very much for this opportunity.